But John, you've led the Indiana Health Information Exchange for years and helped stand up CSRI. How did you get pulled into the interoperability movement?
Well, if you mean in the way back, I'm kind of unique in that I can literally tell you the day and the hour when I decided I wanted to get into the health information exchange business. And it was December 2003, and I was in Chicago at a conference, and there was a guy giving a talk about what they then called local health information infrastructure, long gone term. But it was basically, what's wrong with healthcare is we've got all these silos, and it affects patients and populations and policy when we aren't sharing this information between relevant organizations in healthcare. And I'm like, you know what? That's right. I want to work on that problem. So it's been that long ago.
John, you've seen the evolution of early health information exchanges to today's health data utility conversation. What motivated you to help shape this national concept?
Yeah, thanks. Let's spend a minute on this because I personally don't think I'm shaping anything. If anything, I think I'm trying to help be one of the people shining light on this evolution, which is, I think, the right terminology. I think, and we're going to talk more about what is a health data utility and what's versus a health information exchange. Big misconception. I think the reality is that as some health information exchanges many years ago started branching out and doing more things for more segments of healthcare, at some point in time, they were doing what I would call HDU stuff. And so by calling out HDU and defining it and writing capability models, we're really just, I think, pointing to the fact that at some point, what was early health information exchange that was fairly narrowly focused on patient care evolved into a lot more broader, valuable thing, and we're giving it a name.
Yeah, so for those who may not be familiar with CSRI, what is the Consortium for State and Regional Interoperability, and what prompted its formation?
Right, thanks. The CSRI is not a well-known organization. It's not trying to be out front. We're just trying to advance the health data utility concept and help organizations that want to be guided by that model. Our vision is that every state has a statewide health data utility. For example, we're going to talk about the capability model that CSRI recently published, which we're basically sitting around thinking, what does the industry need to help move us forward? And we believe this model was one of those needed things.
Yeah, so how does it connect to the broader federal efforts such as TEF, the ONC's standards and certifications, or the CDC's data modernization strategy?
We don't control the answer to that question, right? But I think the answer is that, and it was certainly a motivating factor, as some of the health data utility leaders of the country were in dialogue with federal agencies. The agencies really wanted to be less confused about, what is a health data utility? And we've got people using that term in different conversations, and we're not clear what they mean, and we're not clear how that, more importantly, how that assures us that these organizations can be helpful. For example, if you're the CDC, and you want information on syndromic surveillance, how do you know which organizations are ready and capable, or to what degree they're ready and capable? So the capability model, you asked specifically about the federal government. That certainly isn't the only application, and it may not even be the most important application of the model, but it, I think, is important to working for health data utilities to work with federal agencies to give them some assurance of, this is what the capabilities of my organization today. This is where we stand on different things that may be important to your agency.
Can I ask a quick follow-up